Hi guys, I'm Rachel,
I'm Kira.
I'm Emily.
and we're gonna be presenting our treatment project today. So we had case 4A, and our client's name was Leo. He's a 4-year, 7-month-old male. He is a bilingual English Dutch speaker, and after doing research, we suspect he has childhood apraxia of speech. Leo's father is the primary Dutch speaker in the house, but a majority of his language exposure is English. Some of his speech milestones indicate delayed first words at 20 months. He started combining words around 24 months. His mother reports that he only really communicates in simple sentences. Leo also does receive physical therapy through early intervention at age 24 months and still continues to receive those services through CPSE once a week for 45 minutes. He still receives speech therapy at preschool in a group, twice a week for 30 minutes. His parents have only reported about a 50% speech intelligibility, whereas his teacher only reports about 25.
Upon our assessment of Leo, we believe that he presents with symptoms of childhood apraxia speech as well as a phonological disorder. As for his apraxia speech, he has a lot of inconsistent errors in his speech production. However, when asked to repeat the same word 3 times, his productions of monosyllabic words were mostly consistent, especially those with a CV or CVC structure. However, his productions of multisyllabic words, or words that have a more complex syllable structure, that tends to vary. So, for example, when he was asked to repeat elephant 3 times, all 3 of those productions were different. His breath support, volume, and resonance were found to be within normal limits. However, he did have some difficulty with repeating rising and falling intonation at the sentence level. He also presented with limited stress patterns during his evaluation. Furthermore, for the oral motor subtest of the DEEP, which is the developmental evaluation of articulation and phonology, he got a score of 32, and a score of 47 is what is expected of a child his age. And then lastly, these patterns in his speech were not determined to be a result of his second language because they are present in both English and in Dutch.
So as Kira mentioned, the DEAP sample also showed instances of the following in his speech. So there were 25 instances of final consonant deletion, 18 instances of cluster reduction, and 6 instances of cluster simplification, 11 instances of either weak or strong syllable deletion. And then we also saw a lot of gliding, stopping, and derotization of his R's. So here are our goals that we set for Leo. The long-term goal is that Leo will demonstrate age-appropriate and intelligible speech within 1 year of starting therapy based upon the DEAP, again, the Diagnostic Evaluation of Articulation and Phonology, with his score being within normal limits administered and scored by the SLP, and the inconsistency subtest of the Goldman-Frisco test of articulation, where he is asked to repeat the same word multiple times. He will hopefully produce the target word consistently for 3 repetitions in 5 out of 6 trials. Right now, he's only doing that for 3 out of 6 trials, which are only, like Kira said, the words that have a more simple, sorry about my dog barking, a more simple syllable structure. And then our short-term objective is that the client will reduce instances of final consonant deletion by producing the final consonant sound at the word level in 80% of opportunities given clinician modeling of each word for the purpose of increasing word length. So here I'm just going to talk about why we picked this goal for Leo. So as I mentioned, there were 15 instances of final consonant deletion out of 48 words in English, and there were 6 instances out of 15 words in Dutch. Final consonant deletion is a phonological process that should be eliminated by age 3, and Leo is closer to age 5. And then here's our study that backs this treatment approach. The study conducted by Giroux and Morissette in 2013 found that the use of minimal pairs in treating final consonant deletion was very effective for both single and multisyllabic words. More specifically, when comparing minimal pair contrast and minimal pair categorization, the categorization strategy promoted greater generalization to new words. So words that weren't used in the sample. And then we're going to show you our mock session where we used this approach.
Now we're going to show a demonstration of how we were targeting final consonant deletion. This clip shows the clinician, Emily, and the client, Leo. The clinician will demonstrate the concept of final consonant by
So today we're going to talk about the sounds at the end of our words, okay? So we can think of the sounds at the end of our words like tail, right? So animals have tails. If I cover up the tail of a dinosaur, he looks kind of silly, right?
Yeah.
How about a shark? If I cover up his tail, he looks funny.
Yeah, he looks silly.
Yeah. Sometimes if we forget the sound at the end of our words, they might change the whole meaning of what we're trying to say.
Now, this next portion will target reducing the client's instances of final consonant deletion at word level by utilizing the near minimal pairs approach using picture cards. The clinician will use high-frequency feedback in the form of verbal and visual cues, consisting of reminders, phonemic cues, and direct modeling if necessary to elicit the target. The clinician is also using specific positive reinforcement when Leo produces the word correctly.
Okay, so now we're going to look at some picture cards. So here I have two words. I have a pea and a peach. One of these words has a tail, right? Peach has the sound at the end. Like if you ask mommy for a peach, but you say pea, she might give you a pea, right? If we forget that tail at the end of our word. Can you try? Can you tell me pea?
Pea.
Now tell me peach.
Pea.
Close, but I'm still hearing pea. Let's try to put that tail at the end. Peach.
Peach.
Good. I love how you said that tail. Let's try another one. Here we have go and goat. Tell me go,
Go.
goat.
Go.
Close, but I'm still hearing go. I really want to hear you say that t sound at the end. Can you say goat?
Go.
Awesome. All right, here's another one. Here we have so and soap. Tell me so,
So.
soap.
So.
I'm still hearing so. Can you try again? At the end. Soap.
So.
Excellent. You're doing really well adding those final sounds. Okay, how about T and team? Try T.
T.
Excellent. Now how about team?
T.
I'm still hearing T. Try adding that at the end. Team.
Team.
Excellent. Now I know what you're trying to say. How about this one? Cow and cow. Tell me cow.
Cow.
Now add that final sound. Couch.
Cow.
Close. Let's try to add that sound. Couch.
Cow.
Excellent. Another one. We have a tie and we have someone typing. So tie and type. Tell me tie.
Tie.
Now tell me type.
Tie.
Let's try to add that sound. Type.
Type.
Good. Excellent. Here's lay and here's lake. Tell me lay.
Lay.
Now tell me lake.
Lay.
Let's try it again. I'm still hearing lay. How about lake?
Lake.
Good. 3 more. You're doing really well. How about bow and boat? Tell me bow.
Bow.
Boat.
Bow.
Let's try it again with our T sound at the end. Put that tail on. Boat.
Boat.
Excellent. I love how you added that tail. Okay. Here we have moo and moose. Tell me moo. Moo. Moose. Moose. Oh my gosh, I love how you added your tail. That was really great. Okay, let's do one more. We have boo and boot. Tell me boo. Boo. Try this one. Boo. Excellent. I really love how you said that final sound.
And these are our references. And thanks, guys.